Auckland's medical school says it's ready and willing to train up more doctors to help fill the shortage, but the government won't let them increase student numbers.
But the Health Minister says it's not that simple. Kithiki Masalamani reports.
The health system is straining at the seams, tackling COVID and the flu season, while also dealing with a shortage of staff.
We have a lot of vacancies. We have vacancies in other medical positions as well, and we're doing everything we can to recruit into those roles.
Doctors say the shutting of the borders helped expose the system's Achilles heel.
Our over-reliance on doctors who are here on working holidays, our UK grads in particular, wonderful people, very competent doctors, but of course they go home.
Dr Deborah Powell says our medical schools need to graduate another 50 doctors a year to fill the shortfall.
The modelling on that was done a few years ago now, and we should have got onto it then, quite frankly.
But there's a catch. The government caps the number of students medical schools are allowed to train. The University of Auckland admits 257 domestic students a year. Otago admits 282.
Every year we turn down many people who would be more than adequate doctors. There's no shortage of applicants, I promise you.
When you say many people?
Hundreds who do not get in who would make good doctors.
Dr Warwick Bagg says it's a costly exercise to train doctors, $62,000 per year. Around $16,000 of that is covered by student fees, and the rest is footed by the taxpayer. He says they've asked the government for more funding, but it hasn't been forthcoming.
We have the capacity, we have the expertise, we are ready, and it is cost effective.
But the government says capacity at medical schools isn't the issue, rather the ability DHBs have to cope with the new graduates who need supervision. In a statement, Health Minister Andrew Little agreed increasing the intake at medical schools is a sensible approach. But he says we need to look at the whole process, from entry to med school to professional training years, and make sure there's capacity at each step. He says he'll ask the new board of Health New Zealand to prioritise medical training. Kithiki Masalamani, Newshub.